I chose to study at Edge Hill because it's a friendly campus with lots of support and people who will come and help you. There's a 24-hour door system, so whenever you need help, there's always someone around to help. And off recommendation of my friends as well, so they'd already studied here and loved the campus and loved everything about it, so there's like a real community feel when you get here.
I came to study at Edge Hill because I'd already been a student here previously. I'd completed my nurse training at the faculty and already had some quite well-established relationships with the staff here. I knew about the faculty growing research profile and was sort of wanted to be part of that really, and to be interested in, play a role in developing what was going on. The project I also undertook that was being advertised that I've ended up completing or going through was in relation to something that I felt quite strongly about, which was in the area of restricted practice and holding children with learning disabilities for procedures. So it was a two-way decision really. I was familiar with the faculty, but the project actually matched my interest.
Firstly, the studentships were advertised, and I was interested in the topic areas with my background as a clinical nurse specialist for stroke. So I was quite keen to learn new skills and improve practice at the same time. So I applied for one of the studentships, and to my surprise I was offered, and now I'm here at Edge Hill.
So a few years ago I came to the UK from the States to do a master's, and I quickly realized that I want to continue on in the academic environment and pursue a PhD. I realized then that overseas students usually don't have the same offers and can't pursue a PhD, at least a funded one, in the UK, and so I assumed that dream was kind of, it's going to take a while, at least maybe even being dead. And so I started working in London and found this opportunity at Edge Hill for a paid GTA PhD studentship, and it kind of seemed like a dream come true because it was open to overseas students as well. And so I interviewed, got accepted, and came up. And I chose health because I did my previous 2 degrees with a health focus in business and my master's in public health, and health just seemed like the comfortable confines where I was supposed to continue researching.